Today we're going to talk about the highest yield, which is exactly how the NBME wants you to think when you're taking step 2ck. So here is the best next step. First one is liver nodule. If you see a liver nodule, the first step is ultrasound. If the ultrasound confirms a lesion, the next step is contrast CT scan. If imaging is suspicious, the next is liver biopsy. And the liver biopsy, this is the gold standard in case sometimes they throw that word. What is the gold standard? That's the liver biopsy for cirrhosis. Lung nodule. If a lung nodule is found, always compare with previous chest x-rays first. If the nodule had changed, the next step is a CT scan. Proteinuria. If you suspect a proteinuria in urinalysis, the next best step is a 24-hour urine collection. Metabolic alkalosis. If the patient has metabolic alkalosis, check the urine chloride. If urine chloride is less than 20, think vomiting or volume depletion and treat with IV fluids. If chloride is greater than 20, think hyperaldosteronism and treat with spironolactone. The next is anemia. If you suspect anemia, then of course do check it with low hemoglobin, and your next step after you do that, your next step is reticulocyte count and MCV to classify the cause of anemia. The next one is catheter-related sepsis. If you suspect catheter-related infection, remove the catheter and send the catheter tip for the culture. The next one is BCG vaccine and positive PPD. If a patient had a BCG vaccine and now has a positive PPD, the next step is IFN gamma release assay to rule out the first positive, to rule out the false positive. I know some people might say x-ray after they got a positive PPD, but these days NBME is throwing off like interferon gamma release assay, so keep that in mind. Bloody stool and fever. So your next step is stool WBCs. If stool WBCs are positive, send a stool culture. If stool WBCs are negative, give symptomatic treatment. And the next one is if you suspect a C. diff infection. If you suspect C. difficile infection, order a C. diff toxin assay. Another one here is chronic diarrhea with blood. The next step is colonoscopy because you want to evaluate for any inflammatory bowel disease. And another one here is after treating the H. pylori, how do you know that the H. pylori has been treated? So to confirm the eradication, order a fecal H. pylori antigen test. Another one I got here is suspected GI cancer. If you find a GI cancer, the next step is a CT scan for staging and prognosis. Another one I got here is suspected aortic dissection. If you ever see in a hemodynamically stable patient, if you suspect aortic dissection and the patient is stable, definitely go with CT angiography to confirm the luminal tear. And another one here I got is suspected renal injury. You cannot use CT contrast if the patient has renal injury, and of course you can't do the contrast CT. So what would you do? The next step here is echo. Echo. Diabetes with new onset heart failure. If you find a diabetic patient with a new heart failure, you should go with coronary angiography because diabetics often have silent ischemia. So to rule out that, definitely go with coronary angiography. And if you see unexplained pleural effusion and the cause is unclear, the best next step is thoracentesis. That's it for today. That was the rapid high yield best next step review. Thank you.